And welcome back to Smiles by Mary. I'm Pat Dewar. The host of the show is Dr. Mary Swift. We're talking about Invisalign, which is a special kind of bracing or braces that you would insert into your mouth, and they're invisible to most people and comfortable for the folks that are wearing, aren't they, Dr. Mary?
That's what they tell me. And I had it. I wore Invisalign personally too, and it was just so easy and comfortable.
I know one time I heard you say that some people actually lose weight on these things.
Yes, it's the Invisalign diet. You're wearing the trays, and for Invisalign to be effective, you have to wear the trays. 22 out of 24 hours a day is what is recommended. So you take them out to eat, you take them out to clean, but if they're not in your mouth, they're not going to move your teeth. And so you start looking at snacking a little differently. You know, do I really want to take that tray out just to have a bite of something? So we say there's an average of about 5 pounds lost.
That's good.
And I joke with my patients and I say my cuticles never looked so good because I can't, you got these trays in, you can't. It's so easy to do, and it's one of the most asked for procedures in my practice. And as we talked about before the break, people who had braces at one time and saw how straight their teeth could be, those are the ones that are really wanting to get back in alignment. But as we talked about before the break, there's been some advances, and Invisalign now conquers even more complex cases than just a little minor crowding. One of the biggest applications in my practice for Invisalign is pre-restorative. In other words, before we start fixing the teeth, we get them into the best place possible. Alignment all the way down the spine starts here. Joint, if you think of a hinge in a joint, all of that has to be aligned all the way down. So if you've got healthy teeth alignment, you literally are going to live longer. There is research that indicates that the more teeth you have as you get older, the longer you live. Digestion and nutrition starts with chewing, and you want that function to be healthy the whole way through your life, and it's going to stay healthier if it has all of the alignment checks and balances that have to do with proper occlusion.
That's cool. So what I'm hearing is that folks that are looking at, maybe they want to get veneers, or they have a tooth that they need to replace and they have an implant.
Especially veneers, Patrick. I have, I can't name names, but a patient who had veneers done at another practice, and they kept coming off, and they kept chipping, and they kept breaking. And so she's in my chair going, what is going on? And it was basically the restorative dentist didn't kind of consider the position of the teeth before putting the pretty veneers on top. And if teeth clang and bang each other in the wrong way, those veneers and porcelains they're gonna pop right off. So that's, as I was alluding to before the break, if you get everything in proper alignment first, like improving the foundation on your home, before you make those cosmetic aesthetic improvements, that's money better spent. You're going to get a better outcome with fewer repairs if you have everything lined up.
What's interesting is my brain goes into things like cars, and I've heard Lexus is a really well-built car, and that's one of the things that I hear is just very smooth. So in other words, they've gone in and they've created that right setting,
foundation,
and then when they put the veneers on afterwards, your teeth are able to stay looking beautiful for a much longer time period. And I know that you guys even your work lasts usually the rest of their life, or a long time.
We can't make that promise because we don't know what you guys are doing to our dentistry out in the real world. But it certainly has a better prognosis. That's our big term for how, what we think, what we predict of lasting if the alignment is correct before the porcelain is added.
Any other stories of people that have been using, they got in, they did Invisalign, and what changed in their life?
One of the other considerations when you're looking at how proper alignment improves the smile and the health of the patient has to do with gum and bone issues. If you've been told you have periodontal issues, gum and bone disease, any bone loss, and you have crowded teeth, you have more nooks and crannies to try and take care of. If you have a tendency towards any kind of gum disease, straightening things up, gaining good access to be able to clean without nooks and crannies improves gum and bone health.
It just reminds me of the last time I was in there and they were cleaning things and they found a little pocket and they're like, "You saving something for later?" I'm like, "Not intentionally."
That's exactly what we call it, pockets too.
Yeah, yeah. So, you know, I look at the way that it changes lives, and I think that's one of the biggest things when you're really talking about the idea. Anything else that you'd want to say about life-changing?
Life-changing, one story, young man, he had braces as a teenager, but he continued to grow, and with the growth he had spaces in between his teeth. Spaces in between your teeth is a bit of a juvenile look, and he was at a point in his career where he needed to look grown up.
Oh,
and Invisalign closed the spaces and it matured his smile appropriate to his age and position.
Outstanding. I know we've got another break coming up here, and you're listening to or you're watching Smiles by Mary. This is Pat Dewar. We'll be right back.
Staying involved in dentistry on every level, local, state, and national, makes me a better dentist. Our patients are our life and our livelihood, and we appreciate every single patient that walks in that door. And these are our family, and we treat them that way.